Hey guys, I am back. So you know how I am. I am Belize Spivey, known as the STD Life Coach, and I teach you guys everything you need to know about your herpes diagnosis or an individual who simply wants to learn about herpes simplex and simply how to prevent from contracting it. So today we're going to talk about HSV2, which is genital herpes, and oral sex, okay? This is very important because people don't realize really understand how it works, because when you're reading online, it kind of seems like you can't get oral HSV2 orally. Not true. That's not true at all. It's a very big misconception that it can't happen. But you'll be surprised that many people who have HSV1, which is oral herpes, which is cold sores, fever blisters, are the main reason why people have genital herpes. No, I'm not saying that HSV1 turned to HSV2. What it did do was create HSV1 genitally. So this is where all the confusion comes from. So because many people believe, oh, I have genital, so I have HSV2. Look at your test results. Chances are you may have HSV1 because more people have HSV1 than they have HSV2. And that is so crazy because you're thinking like, what, how, but it's genital. Because most people don't even know cold sores and fever blisters is herpes. They use the words cold sores and fever blisters so interchangeably that they don't even bring up the medical word, which is herpes simplex virus, which can simply be passed into the genital areas that makes it an STI. Now, what I am going to say is just because you have HSV1, which is cold sore and fever blisters, does not mean you have a STD. Okay, and the reason I'm going to say that is because you possibly got it from a family member. Okay, you possibly got it from sharing something with someone who was having an outbreak at the given time and did not know it was contagious. Okay, so I do want you guys to understand that you can have you can have it, and that's exactly how it works. I don't even want to go over it over and over because you can just go back and kind of listen to what I'm saying. So many people are thinking that because they have HSV2 that they cannot pass it to oral. Yes, you can. It's just not as common as people think because HSV1 is the main cause of people having genital herpes, which is causing it now to become an STI. So if you have HSV2, yes, you can have oral sex. You can perform oral sex. You're not going to pass it to somebody because you don't have it orally, you have it genitally. But if somebody perform oral sex on you, the chances are there that they can get it orally. Okay, so then it'll be HSV2 orally. Okay, clear? Clear. Somebody asked me a question the other day. It's like, if I smoke, if I HSV2, can I get it? Absolutely not. You don't have it orally. You have it genitally. So, guys, I really want you guys to get caught up on where your location is, then quote unquote the type. Now, for my individuals who do not have any outbreaks at all, they find out their diagnosis but have not experienced any symptoms, no cuts, no blisters, no itching, burning, discomfort, anything at all that you can identify that where you're having it. For you, I can understand your frustration. I can understand your nervousness about having oral sex because you're like, I don't know if I have it orally. I don't know if I generally. Treat it as a symptom of I have the virus and it is present and I don't know it sometimes. And then just tell the person that you're dealing with, hey, I have herpes and I don't know where it's located. But this is what we can do to try to prevent, any symptoms, okay? For you, I would strongly suggest just take antivirals while you're in relationships, or if you don't want to do antivirals, do lysine, do oregano oil, do black seed. And this will assist you in having that peace of mind and also knowing that you're doing something with your partner. But if you are still in a place where it's like, okay, Belize, I get what you're saying, but I still need some help having some clear understanding. I have a couple of more questions that I need you to book a session with me. Sessions are available this week. You can book a 30-minute, 15-minute, or an hour. This type of conversation, an hour, is the best, okay? I will suggest 15 minutes because most people are not. They want to tell me their story and all these other things. So 15 minutes is really like a consultation and really quick questions and already know who I am and already don't talk to me in detail. But for my individuals who would never talk to me, you need a 30